Are your periods so painful they stop you from living your life or the life you know you should be living? Maybe you've been told that it's just bad cramps or your heavy period is just your normal period. And they just hand you some birth control as the only solution. But what if I told you your pain isn't normal and the reason you are suffering is that doctors often misdiagnose the real issue? Y'all, in this episode, I'm breaking down the difference between adenomyosis and endometriosis and why so many women go undiagnosed for years, up to 20 years, and how you can start healing naturally, whether you have a diagnosis or not. And trust me, the symptoms you have been ignoring might just be telling you something bigger. But you already know what time it is. Vibe with me, y'all. Welcome to the Empowered Plates, Empowered Lives podcast. Welcome back to another episode of the Empowered Plates, Empowered Lives podcast. It's your healthy habits and lifestyle coach Jovonnie, and today we're diving in a topic that too many women are struggling with in silence, and it's called painful periods and misdiagnosis. If you've ever felt like your pain was dismissed, or like doctors weren't giving you real answers, or like you're just supposed to deal with it, this episode is for you. And you, and you, and you, and you. Y'all, whether you've been diagnosed or not, you deserve to understand what is happening in your body. So let's break it all the way down in a way that actually makes sense, because knowledge is power. And I want you to feel empowered to take control of your health. So what we're going to do is we're going to start with what are adenomyosis and endometriosis. You're probably like, what are those terms? Or you might be saying, you know what? My doctor is suspecting these things, but I have never even heard about it. Or you could be like, my teacher mentioned something to me about my painful periods and feeling nauseous and being sick or having irregular periods just isn't normal, and that she has experience with endometriosis and adenomyosis. And so what I want you to do is I want you to think about your uterus like a house. The walls of the house are made of a special lining called the endometrium. And this lining is what sheds during your period. Now imagine two things happening in this house. One, adenomyosis. Instead of staying on the surface, the endometrial lining burrows into the muscle of the uterus, almost like roots growing into a foundation. And when I tell you it's roots growing into a foundation, it really makes the uterus thicker, swollen, and extremely painful, leading to heavier periods, intense cramping, and bloating. Y'all, adenomyosis is nothing to play with. And shout out to my adenomyosis thrivers who are absolutely embracing this journey of strength almost every single day. And some of the common symptoms of adenomyosis is extremely heavy periods. That's like soaking through pads or tampons in 1 to 2 hours. That is not normal. So if that is your norm, you need to take that to your trusted healthcare professional and let them know that you are having extremely heavy periods. Then you have painful cramping that feels like contractions. Whew. So painful that you're doing the Lamaze breathing and you're not even having a baby, because the pain from those cramps are just absolutely unbearable. And then you have bloating that makes you look several months pregnant and you're nowhere near pregnant. Like just huge bloating of the stomach that just kind of comes from out of nowhere, and you're just like, what is going on with my body? And then you have back pain or leg pain before or during your period. If any of those symptoms are something that you've experienced, or even multiple ones that you've experienced, you might want to jot down adenomyosis, do a little bit more research, and take that to your healthcare professional. All right. And then we have endometriosis. Instead of staying inside the uterus, the endometrial-like tissue grows outside of the uterus, on the ovaries, the fallopian tubes, the bladder, and even the intestines. Endometriosis does not stay in one place. It can grow all over the place. And if this is your first time listening to the Empowered Plates, Empowered Lives podcast, go check out other episodes with guests that have shared their journeys of strength with endometriosis, with adenomyosis. Y'all, those journeys will allow you to see that these conditions, they don't have a one-size-fits-all approach. Everyone doesn't experience everything the same. And a lot of times, they started at a very young age. Their symptoms started at a very young age, and they had no idea what was really going on with them, nor did their medical professionals. So when you think about this tissue that acts like it's part of your period, bleeding and shedding, but because it's in the wrong place outside of the uterus, it causes inflammation, pain, and then scar tissue buildup. And y'all, this scar tissue can just be found anywhere in the body, just building up, causing and wreaking havoc and pain. It could be a lot. And so the common symptoms of endometriosis could be painful sex, like sharp or burning pain, painful bowel movements, y'all, like glass cutting inside. The painful bowel movements I experienced, I used to have to grab on the side of the walls when my menstrual cycle would be on and I'm passing a bowel movement. Like, it was unbearable. I'm trying to focus on my breathing. I'm trying to relax, but the pain was just so intense. And you know what was silly? I actually just thought that was just my normal painful experience for so long, until I was diagnosed with stage 4 endometriosis, adenomyosis, polycystic ovarian syndrome, and then at the time of my surgery, 2 small fibroids were found in my uterus. Y'all, that painful bowel movements was one of my main symptoms. And leading up to right before diagnosis, the unbearable back pain, low back pain, was just out of this world. But you also have severe period cramps that feel like stabbing, and then chronic fatigue and brain fog, just always feeling tired no matter how much rest you got, or just being able to not remember things or forget things, and just the brain fog is just fogging. Okay, but listen, if you've been tuned in to the episode this far, I want you to subscribe to this channel. If you're watching on YouTube, and if you're listening on your favorite podcast distribution platform, make sure you follow the Empowered Plates, Empowered Lives podcast, and also give the show a rating. Y'all, statistics are showing that 66%, I think it's 66% of my listeners are tuned in, and they're only listening like less than a minute, not even a whole minute, less than my subscribed followers. So you're getting just as much value, but you're not subscribed. So make sure you subscribe to the channel, make sure you're following, and let YouTube know that you're getting vibes and value from the show. But let's get into it, because now we're about to talk about why doctors get it wrong. All right, so here's the frustrating part. Doctors often confuse adenomyosis and endometriosis, or they completely overlook them. So some women are told they have fibroids when it's actually adenomyosis. Others are told their pain is just bad cramps when it's actually endometriosis. And so if you heard me a little minute ago, I told you I had endometriosis, adenomyosis, polycystic ovarian syndrome, and 2 fibroids. So it can be a lot of different things and not just one or the other. So the truth is, we can have multiple conditions, one condition, all at the same time. And so the problem with the misdiagnosis or the delay means that you could potentially be getting delayed healing, staying confused, staying stuck in this pain that you don't deserve. And so the longer you go without the right information, the longer you suffer. I'll say it again. The longer you go without the right information, the longer you suffer. But here's the good news. Whether you have a diagnosis or not, you can start healing naturally today. And you're probably like, Healthy Habits and Lifestyle Coach Jovonnie, what do you mean? If I don't even know what's really going on in my body, how can I go ahead and start naturally healing today? Let me let you know. I had one coaching client that was in debilitating pain almost every single day, dependent on over-the-counter pain medication. This is not even when her period is on. It's when her period's on, when her period was off, just debilitating pain, not knowing when she's going to be in pain and when she's going to be up, vibrant, and thriving. Y'all, we started making healthy habits and lifestyle changes. She started feeling so much better, reducing her pain, feeling good, feeling empowered. And so it was about maybe 9 months after working together that she actually got an official diagnosis of adenomyosis. And by this time, most of her pain, her period pain, her pelvic pain had decreased a lot. So I just wanted to let you know, in case you were doubting that you needed an official diagnosis before you could start healing, that you can. And that a lot of times it's in your lifestyle, it's in different habits that you have, that you start exploring these habits and lifestyle changes, that you start being empowered because you start to feel better. And the more you feel better, the more you want to do things that help heal you naturally, even when you just don't know exactly what all is happening in your body. So I want you to be empowered while you're on this journey, because it's your healing, your journey. So I want to give you 3 steps to start healing with or without a diagnosis. Number 1, how to advocate for yourself and get the right diagnosis. Y'all, doctors misdiagnose these conditions all the time. And sometimes they don't even know what is going on. And if you're not properly coming into that appointment with documentation, letting them know how much of your life you haven't been able to enjoy because of the pain, because of the heavy periods, the absent days from school or from work, or being able to not be present for life experiences that you really enjoyed, or you want to get back into enjoying the things in life before your body started to just react the way that it's reacting. Start advocating for yourself. Take that documentation, take those notes to your doctor, and ask for a pelvic ultrasound, ask for an MRI or a referral to a specialist. Keep a symptom journal to track pain, bloating, and fatigue patterns, because when you have clear data, it's harder for doctors to ignore you. And even if they do dismiss your pain or ignore all the things that you're showing them and telling them, jot that down too. Okay. Denied such and such, such and such. Okay. Refuse to give me so and so. Let them see you documenting these things while you're in that doctor's office. But you have to remember that you're your biggest advocate. You matter more than anything else. And so I want you to make sure that you always advocate for yourself and that you feel empowered to never give up on figuring out what is going on with your body. Because once you have that knowledge, you have that power to make your decisions on how you would like to heal and move your life forward. All right, here we go. Number 2, how to start healing naturally, even without a diagnosis. Again, it could just be you've experienced some of these symptoms that I mentioned for endometriosis or adenomyosis, but you don't have an official diagnosis, or you just got recently diagnosed and you're like, I don't even know what these conditions are. They said there's no cure, but I want to live a more vibrant life. You deserve to live a more vibrant life. So reduce inflammation with specific food swaps, avoiding dairy. That was the biggest thing for one of my coaching clients with adenomyosis. Avoiding dairy shifted her pain tremendously. Processed sugar, and even sometimes gluten. Instead of focus on leafy greens or turmeric that you can add into your foods or into your juice, flax seeds that you can add into your smoothies, or any forms of omega-3s, y'all. Even small changes can make a big difference in how you feel. Small changes can make a difference in how you feel. Drop that in the comments. Small changes can make a big difference in how you feel. And then number 3, y'all, how to break free from the trial and error cycle. So if you feel like you've been trying random diets, supplements, or workouts with no results, it's because you need a customized approach. And that's why having a clear plan can truly save you years of frustration. Y'all, you're not going to get it all figured out in one time. And you should definitely not think this is a quick fix, or fad diets are sustainable, because they're not. Remember, you're looking for lifestyle changes, and you want to live a lifestyle that you enjoy, that you love, and that's allowing you to feel the way you deserve to feel. And that's less pain, more vibrancy, and being able to do the things you love and care about, and not feel like you have to miss out on things because of a bad endo flare, or just a heavy period where you don't even feel comfortable leaving the house without your clothes getting messed up. And so what I want you to do is I want you to really give yourself the grace and the time to progress with your healing journey, and not feel like it has to be perfect. And a lot of times you have to first start with an elimination diet to even see what is going to work with your body. All right. So the 3 quick takeaways: adenomyosis grows into the uterus, while endometriosis grows outside of the uterus. 2, doctors often confuse them, which leads to misdiagnosis and delays in healing. And the only option of birth control is not your only option, especially if you don't have a true diagnosis. Get answers, do the investigation, and advocate for yourself. And lastly, number 3, you can start healing naturally today, okay? By reducing inflammation, balancing your hormones, and moving your body in a supportive way. And you might be saying, well, Healthy Habits and Lifestyle Coach, how do you know I can do that? How do you know I can start healing today? Because that was me. I took my healing journey and I embraced it. And it wasn't easy. It took years of figuring out what was going to be best for me. And I am just here to say that my M to the 3rd degree healing empowerment formula, mindset, mindful eating, and movement has transformed my life. And it's allowed me to help others do the absolute same. And again, I didn't just have one condition. I had endometriosis, adenomyosis, polycystic ovary syndrome, and 2 fibroids at the time of my surgery, of figuring out what was going on inside of my body. And that shifted my lifestyle. This pain that I experienced gave me permission to go and live a more purposeful life, to live with more intention, and really embrace a journey that allowed me to get back to loving me in a way that I never knew that I could. And you deserve that same journey. You deserve that same love. You deserve that same care. So yeah, it's your Healthy Habits and Lifestyle Coach Jovonnie. In the description, I got something for you. So check the show notes. But most importantly, thanks for vibing with me, y'all.